called Where Are They Now? Aspen Dental Doctor Edition. We'll go ahead and do introductions here in a second, but what you're going to hear from tonight is we have 3 of our doctors with us that all were in your shoes not long ago. They are 2022 graduates. You'll hear from them in just a moment, and they're going to answer some questions that we have queued up, but we'll also take Q&A. So my name is Paige Klosterman. I am a part of the Aspen Dental academic team. I've been with Aspen for a year and a half, and I work with dental students out of the states of Texas, Oklahoma, and Colorado. And I'll shoot it over to Elizabeth to introduce herself.
Awesome. Thank you, Paige. My name is Elizabeth Ferreira. I've been with Aspen a little bit over 3 years now. I actually started on the doctor recruiting team. And a few months ago, back in July, actually, my fellow coworker, Maggie Maurer, who a lot of you know, she let me know that, she was moving territories and thought that I should potentially look into stepping into the academic role in New England. So right now, I am the academic recruiter for the dental schools in Massachusetts, Maine, and Connecticut. So I've been really enjoying my time since July in this role. Dr. Mark and Dr. Tucker, who we'll be introducing here in just a second, have both been at some of my events. They've been amazing resources connecting with students. So when Paige and I were brainstorming, different doctors for this call, Dr. Naveed was right on the top of her head, as Dr. Tucker and Dr. Mark were on the top of mine. So we're really excited to introduce them to you all tonight. So I'm going to kick it off to Dr. Mark to start and introduce himself to you guys.
Can everybody hear me?
Yeah.
Perfect. I am Mark Puglisi. I graduated in 2022 from Boston University. Currently, I'm practicing in Maine, but I'm from Lancaster, Pennsylvania, good old Amish country, if any of you guys have heard of it. There was one other question that you had lined up.
What made you want to become a dentist? Yes.
Oh, I had basically I was pre-med for 4 years, and then my senior year, every doctor that I shadowed was like, don't go into medicine. Didn't know what I wanted to do with it. Kind of shadowed a bunch of things in healthcare, shadowed a dentist, and after one day I was like, I could do that, and I was accepted to dental school 4 months later. So I joke, some people had shotgun weddings. I had a shotgun career choice. So
well, it has worked out well for you. I'm excited for everyone to hear more about your journey tonight. So Dr. Anshel, I would love to introduce you. Please let everyone know a little bit about you.
Hello, everybody. My name is Anshel Tucker. I am a D22, or I'm a 22 graduate. I went to Tufts Dental School, the best dental school out there for any Tufts students out there. I am from Las Vegas, Nevada, born and raised, and I'm currently practicing in Worcester, Massachusetts. So I'm not far if you guys ever want to come up and visit. And what made me want to become a dentist? I was also pre-med. I switched over when I was like 19. First, it started out with me refusing to take physics on the MCAT. And then I shadowed a bunch of different doctors and then ended up shadowing a dentist as well and fell in love with it. Just like the instant gratification, the way that you can change somebody's life through fixing their teeth. So, yeah.
Awesome. Dr. Shergill, go ahead.
Hello, my name is Dr. Shergill. I'm also a 2022 grad from Oklahoma University. I'm actually originally from California, but I practice in Colorado right now. As an Indian, you only have 2 choices as a career path. You're either a doctor or an engineer. My whole family of doctors said, don't do it. I agree with Dr. Mark that I shadowed a dentist. I was like, this is nice. I like working with my hands. So after a while, it made sense to do the science and the art part together. So it was a no-brainer at that point.
Awesome. Well, thank you guys all for taking the time to join us tonight and for also introducing yourself. So I'm going to kick it off with the first question. So I want to learn a little bit about why you guys chose Aspen. What were your thoughts on DSOs originally, and did Aspen kind of change your mind on them? So let's start off with you, Dr. Tucker.
So what made me choose a DSO originally?
Yeah, what made you choose Aspen, and was Aspen different than maybe your perception of DSOs while you were in school?
So a lot of you have probably, or some of you have heard this story. Aspen got me because we were going out to eat a bunch and I was like, I'm a dental student, I'm poor, and I want the free food. So I was always out with them and they kept inviting me and they kept inviting me. And I'm like, you know what? I like these people. I liked both of my recruiters a bunch. And I'm like, okay, let me listen to what they have to say. I was originally liking another DSO because it was in Las Vegas. And at the time, Aspen hadn't reached there. Now it is there. And Maeve actually listened to me one day at lunch or at a brunch, and I just said, you know what, I'm open. These are the things that I want. And she connected me with my current owner doc, and we just decided to meet and kind of loved each other from there. And I've been bleeding blue ever since.
I love it.
Yeah.
It's great. And at the end of the day, like you had said, you came to these events, you thought maybe that you were just in it for some food and some drinks, but at the end of the day, Maeve listened to you and she was able to match you with somebody that at the end of the day matched what you were truly looking for, looking past location and looking to the right mentor like Dr. Henbill's been for you.
Absolutely.
Awesome. Great. I'll pass it to you, Dr. Mark. Like, what brought you here to Aspen and what did you think about DSOs beforehand?
Yeah, so I was actually pretty anti DSO. I was pretty set on going into like a private practice. But I knew the recruiters in my area really well, Maeve and Maggie, and they kept pressuring me like, oh, just like come shadow for a day. So I shadowed Dr. Nate Oakes, my current practice owner, and I was like, this is awesome. Like, I love the practice, but I was still in my head. I was like, not doing a DSO. Anyway, applied to probably 50 positions, interviewed at probably 8 other places, a lot of them private practice, a few other DSOs, and ultimately it came down to 1, the owner. I really like the owner. 2, the contract, which we can get into later, but it was extremely favorable, not just in terms of compensation, but in terms of flexibility with CE, no non-competes. I just felt it was a very safe option. But probably above all else was the type of dentistry that we do. I saw in private practice, especially associates that weren't owners, were kind of doing nothing but fillings all day. I don't know about everyone else, but I hate doing fillings. I find them monotonous and weirdly stressful. Whereas at Aspen, right away we're doing extractions, dentures, crown, like lots of crown preps, bridges. I just found it a lot more interesting than most other dental positions. So I ended up taking the offer and haven't looked back.
That's awesome. And like you had said, you made that connection with Dr. Oakes, and to Dr. Tucker's point as well, you made that connection with your recruiters. I'm sure at first when Maeve had suggested a site visit in Maine, you probably weren't too keen on it. And then you go to the site visit and it ends up being happily something that you weren't expecting.
Yeah, spot on.
Awesome. Dr. Shergill, do you have anything to add to what the two mentioned already?
Not much. It's just I was in the same boat. I was in the 3rd year. I used to go, for the free food, the free drinks. Didn't really have a plan for anything. But come my 4th year, I started talking to my recruiters. Paige was one of them. Crystal was another, and they actually really listened to what I was looking for, and they connected me to a variety of different doctors. So the current doctor I'm at, Colorado, I actually met him, and it was honestly like meeting an old friend. Our visions of dentistry aligned, what we wanted to do in our career path, the type of dentistry we wanted to do. It all just synced up so well, and it never felt like a job interview. It was like, oh, meeting an old friend. This is what we do. And honestly, the patient base at Aspen is just fantastic. It's like Dr. Mark said, it's not just fillings and everything, it's crown prep, second stage, implants. It's just a variety of things. And you're good and busy, but you're never overwhelmed. So the day goes a lot faster. There's so much variety. It's a very enjoyable thing when you work with a good mentor doctor who helps you ramp up really fast, but in a nice way.
For sure. Thanks, Doc. I want to go ahead and let everybody know we are going to open it up for Q&A probably in about 20 minutes or so. Feel free to start typing those questions in the chat if you have any. We do have another one of our team members who you can't see, but she is monitoring that chat, and we'll make sure that we see those. Otherwise, she will help answer those too. So start putting some questions in the chat if you have any. But we'll go ahead and hit the next question. Were any of you considering a GPR or an AEGD? And what swayed you away from that in the end because you all chose to start practicing with Aspen right away? So I know Dr. Shergill has a little bit of a story on this. We'll have you kick it off.
It was funny, right? I think 4 or 5 days before my interview with my current doctor, I actually got accepted into a GPR program. So I come and met him and I told him, hey, doc, listen, I got into a GPR program and I have this offer from you. I'm a little, I'm leaning towards the GPR. And he just point blank looked at me and said, whatever they're going to teach you in GPR, I will teach you all those things and I'll pay you. And if you're not happy in a year, I'll pay for you to go to GPR. And with the confidence that he said it, I was like, sold. And literally in the first 2 months, we were doing second stage surgeries, third molar extractions, full mouth rehabs. So it was phenomenal. And when I used to call my friends who got into GPR, they were still like crowns, maybe doing one molar endo, but the ramp up and the variety was, I mean, he lived up to everything that he said. So I was like, best decision I ever made.
That's awesome. Dr. Tucker, Dr. Mark, were either of you considering going into GPRs or AEGDs?
I was. I was also getting into a GPR and had spent a lot of time with them. They asked me to come there. It was at UNLV, so I wanted to go, like I said, back home originally, and ended up meeting my owner doc, same thing. She's like, whatever you want to learn at a GPR, you're going to learn here. So she asked me what I wanted to learn. I was very open about that, and same type of situation. No molar endo for me. I really don't do endo at all. I have an endodontist at the office. No third molar extractions unless it's already on its way out. I don't like for my hands to hurt. So I'm a pretty dentistry type of girl.
I love that about you. We love that for you, that you have that clinical autonomy, that you can decide what patients you want to see and what you'll refer out. So that's what Aspen's all about. What about you, Dr. Mark? Do you like pretty girl dentistry too? Do you want your hands not to hurt?
No, I'll take on the extraction. Sometimes I take on a little bit more than I probably should, but we find our way out, which is, and then when I can't, I have somebody there to bail me out, which is nice. Kind of like Dr. Shergill mentioned, but yeah, I mean, very similar story. I had all the application stuff ready to go, had been working with my student affairs for months to get it all ready. And then I talked to some not upperclassmen anymore, but some friends that had graduated the year before. And a lot of them just seemed like their GPRs, they were really regretting. They felt like it was kind of I don't want to say a waste of time, but it seemed like a lot of GPRs out there were just a 4th or a 5th year of dental school where they're like, oh, we're doing like 30 or 50 crowns. And I was like, I did that, I think, my first month at Aspen. So yeah, I mean, I'm happy with my experience. I'm sure there are some fantastic GPRs out there, but a lot of them just didn't seem worth the time or the lost income.
Great point. So I know each one of you has kind of touched on this a little bit already, but I want to dive a little bit deeper. I feel like a lot of times students ask us about mentorship. What does mentorship look like at Aspen? And I think what's important to understand is, each Aspen office really runs as its own kind of private practice due to the owner that, is running that office. But then they also have the backing and the training of Aspen Dental with things like our new doctor training journey. So I'd like to hear from each of you a little bit about what your mentorship looked like with your owner doctor and with Aspen. Who'd like to take it first?
I'll go. So my mentorship was a lot different. I was very honest with my owner. We were all in dental school during COVID. And although I met my requirements, I surpassed my requirements, I was very honest, I'm not comfortable with X, Y, and Z. I want to learn. I'm good with this, but I can be better at this. I was just very honest. I didn't want to like oversell myself, and then they put you in a situation and then you're like kind of, freaked out. But my owner took it very slow. She kind of does almost like her own mini residency, and she's very strategic and very, I guess, calculated. And I don't know, she's amazing. But she'll break it down. She broke it down. We went slow. She's like, I need to make sure you know what you're doing. A lot of times in dental school, we're not taking x-rays after each filling. But before you were moving on to the next task, she had us take x-rays of each filling. If it wasn't perfect, you're going to do it again. And you learn very quickly when you have to sit a patient down and redo that filling because it wasn't perfect. So we kind of build on the skills and then you grow from there. It's not you jump in at my office day one and you have a million crowns and you have all these fillings and you have this, that, and the third, because she's taking it slow, making sure all of your work is perfect, including crown prep. So we went step by step, and then eventually I had my chair, I had my column, and then that's the way she does it. And I was very comfortable with that. And now here I am soaring. So I do appreciate that.
And she is soaring. We're going to hear about a little bit later her path of how she's already gone from associate to lead to soon to be owner, which is very exciting. But before I get ahead of myself, I'll let Dr. Mark speak to his experience with the Oaks team in Maine.
Yeah, so my mentorship experience, it's a little bit more, the beginning is formal. Aspen has that new doctor journey where kind of the first month you're constantly on Zooms once a day, where they just go over, there's like Q&A questions and whatnot. It's an opportunity to discuss with other people that are going through what you are. You have a lot of questions that first month, and everybody else has those questions too. And you can kind of work them together, as well as have resources, especially with things like dentures and treatment planning where you struggle the most. With my owner specifically, it was just kind of a very slow ramp up to seeing my own schedule. In the beginning, I think the first week I didn't touch a patient, and then they really, sorry, I got sidetracked. After the first week, it was kind of like, hey, if there's something in our chair that you feel comfortable taking, go ahead. And then by week 3, they started pushing me. So my 3rd week, I did my first full mouth extraction case, which COVID dentist, my 4 years of dental school, I think I did under 50 extractions. So jumping into a full mouth extraction case, I didn't feel like I was ready, but he was like, hey, I'm here if you need help. I ended up not needing help, which was nice. But then for really the first year, whenever I had kind of a tricky case or questions, I just had them to go to for help. Or if it was something that I had in my chair, but I wasn't super comfortable with, I just made sure that I booked it on a day that my owner was in the office so that she could help me out if I needed.
Dr. Shergill, will you touch on your mentorship experience with your owner, Dr. Ahmed? And if there's anything additional you want to add from like what Dr. Mark was talking about with the new doctor journey in Chicago, you can add on that too.
Yeah, mine was pretty similar. Like when I started, it was almost hand holding. Like I graduated, I was still in the whole 3 hours for a crown prep type of thing. And he would literally be there holding the suction and watching it. Then we would take a scan and he'd go through, like, you can touch up the margins here. This is what's needed. After I got the crown preps, I would struggle with the buildup. Like I would do the buildup, lose my margin, and go from the start. So he would literally be like, see how I do it one time, then he would give me the feedback and literally be there chair side. When I started doing extractions, there were like teeth that would kick my butt. And I'm like, Doc, I'm struggling. It was very nice to have that safety net. So we'd come in the room, literally take a Perrier probe and point it and be like, this is where your instrument should go in, and just push it in this way. And I would literally, once you get that tactile feel, go in over there. It was phenomenal. Like once you have that safety net to be able to do the complicated cases, to start doing full mouth rehabs, full mouth extractions, third molar extractions. And I remember one time we were like, there was this one case that just kicked my butt. And I was like, I don't understand anything that's going on. And he's like, don't worry, we got it. Patient was upset, calmed him down. But more importantly, he always said there's three aspects of dentistry. One's the clinical, one's management, and one's leadership. So after the first few months, I had the clinical down, but now I had to learn how to do leading the leadership of the team, managing my assistants, managing the schedule. So he actually touched on each one of those and built it up. He's like, you're not just here to do just fillings and crowns extractions. I want you to be able to run an office and lead an office. And then it was also learning treatment planning, and more importantly, learning how to present the treatment plan. So, I met Dr. Mark at our new doctor journey, and we had a sort of spiel, like a rush spiel, where they would tell you how to introduce yourself to the patients, go through the treatment planning, and present the treatment plan. Because at the end, presenting a treatment plan to your patient is an art. If they don't trust you or they don't like you and they don't accept your treatment plan, then you have nothing. And you've actually done a disservice to the patient, because if they walk out without doing cleanings or getting that one tooth extracted, you haven't actually helped any patients. So once we worked with that new doctor journey spiel and speech in Chicago, we came back, we finessed it to a point now I can enter a patient, and doesn't matter if it's an easy patient or a very hard patient who's just in pain, there are ways to just communicate effectively with them. So he went through the clinical, the leadership, and the management completely, to a point where I'm sure each of us are in an office and can run an effective schedule, manage the team, and train assistants and just lead it at that point. So it's just a very slow ramp up to make sure all those three tenets are met.
That's awesome. Thanks for sharing. It's something we'll learn about here in a little bit, but Dr. Naveed has recently promoted to an MCD, which is a lead dentist, a managing, I'm blanking right now, but anyways, thank you. But he is now leading his own office in Colorado, just 15 months out of starting with Aspen. So that's pretty exciting. We'll kind of move on to the next question, you guys. I see a bunch of questions coming in the chat. We see you. I have them all here. Elizabeth has them. We will get to those. So continue to ask questions. Don't think that we're ignoring you. We will try to get through as many as possible. But you guys, I'm going to skip over one, because a lot of you have talked about the relationship that you've cultivated with your owner, who ended up being your mentor in your three cases. But tell us a little bit about the patient base and what procedures you're doing most often. And if there's a procedure that you really love, we'd love to hear about that too.
Okay. I do a lot of crown and bridge, just because that's one of my favorite things to do. Like I said, I like to make people beautiful. That's why I entered into this field. It's what makes me happy. I also do extractions. I'll do exo insert cases. Aspen is very well known for our dentures, and dentures in Aspen is completely different from dentures in school. If it was like dentures in school, I would have quit a long time ago. I am not using a face bow. That will stress me out. So it's completely different. Like, the process is a lot easier. It's like very straight to the point. And you see denture patients are very grateful, very, very grateful. You've like completely given them a way to speak and a way to eat, and just to really live a life. So I do a lot of that. I am currently training for implants. So I'm in the middle of an implant training, and I'll be going out to the Chicago training next month. So that's mostly what I do. Like I said, I don't do root canals. I'll probably start anterior root canals back, but anything that takes too long, I don't want to do it. There's specialists for that.
Awesome. What about you, Dr. Mark? What kind of patients and procedures are you seeing in your office in Maine?
Yeah, so Maine has an older population. With that comes a lot of dentures, and with dentures come a lot of extractions. So primarily crown, bridge, extractions, dentures. Obviously, fillings are standard in any dental practice, but I'm not a big fan of them, so I don't book too many of them every day. And then things like veneers, we really don't do veneers in my office. I'm personally not a big fan of them. I think they just come with a lot of headaches. Really, as much of my day, they can be filled with like extractions is kind of where I want to be. That was almost my whole day today. And we do some ortho as well, like Invisalign. But Aspen, it's called Motto, Aspen's own brand of Invisalign, but we do a decent amount of that.
Awesome. I can tell Dr. Tucker's agreeing that she's doing a lot of Motto cases as
A lot
well.
of Motto. We love Motto.
We love Motto. What about you, Dr. Naveed?
Pretty much similar. We've done a couple of veneers, a couple of full mouth rehab cases. I personally enjoy a lot of surgery, so we do a lot of surgeries. Dentures come with it. I had no idea about clear aligners till I joined Aspen. They trained me on both Motto and Invisalign, and we do. I mean, I've done I think 20 cases last month, and it is a game changer when you see aesthetically the difference plastic trays do, and even Motto now that I started doing it, phenomenal amount of changes, and you can always treatment plan the most ideal thing. But personally, I'm a big fan of extractions, so love to do them all day. I agree with Dr. Tucker, no molar endo whatsoever. I do see a few pediatric patients here and there, but other than that, it's just pretty much a lot of extractions, which I like. But they let you do you can make your own schedule however you want. So if you want a whole day of extractions, that's what you do. So I personally like a little bit of variety here and there, but it's mostly extractions, crowns and bridges, veneers. I want to get into Botox soon, so my owner doctors, we're kind of planning on getting that. So that's hopefully on the next agenda very soon. So
Well, Doc, I'll be a patient of yours once that gets completed.
done and done.
The next question we have on our list is actually one that has pretty much come in the chat as well. I'm going to state it as the student has written it, but how do you feel after these, this just short year and a half of practicing? And what is your next career step as you see it today? Like if, kind of your 6-month to 2-year plan. Dr. Shergill can kick this one off.
So for the 6 month, it is definitely want to get implant and Botox trained. That's definitely the one I want to do next. Just like Dr. Tucker, I applied within the next 6 months, whenever Chicago gives you the license. The good thing about that is you go to Chicago, you work with a prosthodontist, and you work with Dr. Burr, who's been placing implants, I think, since 1993. So both of them very highly recommended. You work with the Straumann brand, so the brand is something you're used to. It's American standards. It's not like going to Guatemala and just placing them somewhere else. It's the same standards. And then in the next 2 years, the goal is to definitely partner up and start running more offices that way. So that's definitely the 6 month and 2-year plan.
Awesome. Dr. Tucker?
Okay, so how do we feel after the first few years?
Let's have you talk a little bit about like your journey from associate to lead to Arizona. Like basically, I think they're trying to understand like the last year and a half from graduation. Like, what have you done to be as confident as you are now?
I have always been very intentional. Like I said, I was very honest during my interview. This is what I want to learn. I'm very hungry and I'm very I'm here to get it. So I've always taken my learning into my own hands. I go above and beyond. I shadow other offices. I shadow other specialists. We get off early Friday. Every Friday, I'm at a periodontal office learning surgeries, learning different things about bone grafts. I shadow my oral surgeon. So just being hungry and intentional. I've been learning about ownership. I told my owner day one, I want to be an owner. This is what I'm here for. I'm here for nothing less. And I've been learning that since I started at the office. So that's first thing. So I started off as an associate. I was an associate for 6 months. And then I transitioned into being an MCD. So I've been an MCD for a year now, which is a managing clinical director. So I've been running my clinic by myself. I am currently training another associate. And I have been offered, and I'm a hustler, okay? So I've also been offered an office, or I'm buying an office in Scottsdale, Arizona. So I will be moving to Arizona in a couple of months.
Round of applause for Dr.
Congrats.
Tucker. A year and a half out of school, and she went
That's
from
not typical
associate.
though, guys.
But it's not typical. It's not typical. The way that you just described it doesn't sound typical. It sounds like you are a hard worker, and your fruits of your labor are now waiting for you in Arizona. And I'm really excited for you.
Thank you.
Awesome. So we'll pass it to Dr. Mark. Where do you envision your career, in 6 months, in a year? Are you interested in moving into a lead position if that were to become available?
Yeah, so I'm primary goal right now over the 6 months is just like Dr. Shergill and Dr. Tucker said, implants. I've applied for my Chicago license so I can go there and do the training, as well as taking their surgery course. So Aspen offers an implant course. They also offer a surgery course, which is a little more focused on, third molars, some more difficult extractions. I requested tori removal. So they said they're going to try and get that in as well. They can't guarantee it, unfortunately, because it just depends if the patient is going to be there or not. So that's kind of the primary goal over the next 6 months. I am working on the transition to the lead dentist. That's something that my owner has been working with me for a while, just learning the schedule, learning the ins and outs of how to make a schedule as productive as possible without killing yourself in the process. So that's been part of the 6 month plan as well. 2-year plan is going to depend a lot on me figuring out where I want to live. But if an opportunity comes up to own in Aspen, somewhere that I think I would want to live, that's a great, I certainly wouldn't be opposed to it. I'll say that.
That's awesome. We have a ton of questions in the chat, like we've mentioned, so we're actually going to forego a couple of our questions that we had put to the side. A lot of you are asking very similar questions, great questions. So, docs, we're going to start to get into the Q&A. I think, let's have 1 to 2 answers per question, just so we, in the, interest of time, we can try to get through as many as possible. So the first one that I see here is about furthering your clinical skills. Is there an opportunity to learn clear aligners and implants? We've kind of talked on that a little bit. And so does somebody want to take that?
So yeah, like when I started, I had no idea about clear aligners. All I heard from my orthodontist professors was leave teeth movement to the professionals. So I literally had no idea. Once I came in, we did the training, and once I started seeing the results, it was phenomenal how much teeth can be moved by just plastic. It's insane without metal and rubber bands. I mean, of course, there's a place for all of those, but clear liners, especially Motto and Invisalign, they can make a huge difference. So having that as an adjunct to help, with your patients is amazing. And just like Dr. Tucker and Dr. Mark said, Aspen does offer implant training. So you have to do X amount of extractions, X amount of bone grafts, and then you, I guess, qualify to be able to go to Chicago and do the implant training. Also, if you're struggling with extractions, you have that extraction boot camp to kind of do all the complicated things. So there's a lot of CEs and a lot of clinical things that you can get into. In my case, I actually wanted to learn how to run a schedule effectively, where I was initially those months for a little bit slower in my office. So they found an office for me to go to Arizona. They were in a transition period. So I was actually running that office completely by myself for 2 months. running from room to room to room, doing procedures, seeing new patients, doing the hygiene checks. That's a skill. You don't learn that in dental school, and you don't learn it day one. So as you get more proficient at it, you get better with your time management. So that way, I was very glad that Aspen could help me to be able to do that. So the office ran really well, and I was able to see exactly what I was good at and what I was struggling with. So when I came back to my mentor doctor, he helped me finesse things with just getting that more efficiently. So now that I'm a lead, I'm able to do that a lot better, a lot stronger. So there's a lot of offices, and if you need help, like if you feel like I need more extraction, I need more veneers, anything, they can always send you to Chicago to get trained, or another office, a sister office within the same region, so you can get those skills up to what you want to be.
It's a great summary, Dr. Naveed, about all of the training and support that we have between implants and clear aligners with our motto brands. We have teams in place that are happy and willing to be able to help walk our doctors through. Another question that I think is pretty interesting. So we're about 40 minutes into this call right now. And so far, all we've done is talk about all of the amazingly positive things about Aspen. And we're going to keep it real. Not everything is hunky-dory 24/7. So this person asked, what are some cons about Aspen? Is there anything that you guys, if you could change an aspect of Aspen, would change? Kick it off with Dr. Mark. Right on the spot.
Yeah, so honestly, like it's a weird question because when I was in dental school, like I know the mindset you're asking this from, because when I was in dental school, I had the same thing. It's like, oh, there's private practice dentistry and then there's DSO dentistry. To be honest, in your day to like, you're the dentist, you're running the practice, you're not having like pressure from other people to be like, oh, do it like this, or like do more of this. Like it's your practice. Do things your way. So I wouldn't say there's many negatives and things like that. Really the only negative, and I assume this applies to almost every DSO, is we'll have patients come, like they moved here from Texas, and we'll come in and like we'll have to like do our whole exam and work up on them and come up with a treatment plan, and they'll like complain, they'll be like, I already had a treatment plan. They think that it's like McDonald's and that you get a Big Mac one place, you're going to get a Big Mac somewhere else, whereas it's, you're your own doctor, your own dentist. It's frustrating for patients, but honestly, that's like such a minor gripe because it happens maybe once a week. That you just have to explain to them that we have to come up with our own treatment plans and treat it as such. But it's no different. Besides that, it's really no different than just being your own dentist, or being a dentist in private practice. You just have more opportunities of support, more people to reach out to, more CE that you have access to.
Awesome way to describe it. And when you describe it like that, it doesn't sound like a con at all, Dr. Mark. Those still all sound like great positives. But you're right, a lot of times, somebody even could go into, let's say, one Aspen Dental office and have maybe not the best experience possible. And I think that sometimes can become a con, is because we have such power with our name brand. It can do such good. But at the same time, if one person has one bad experience at one Aspen Dental office, and that office, mitigates and deals with the problem, they could still go and say, oh, Aspen Dental this, Aspen that, which isn't necessarily fair. So personally, as an employee, I would say that's the one con that I have, is I love the brand power in our name, but sometimes it can also transparently be a thorn in the side. I think Dr. Tucker agrees with me here.
I'm like, you took the words right out of my mouth, because it drives me insane. If you've ever looked up Aspen Dental on TikTok, they're like, oh my God, they scammed me out of my money and I did this and I did. Girl, you missed your payment. That's why they started charging you interest. Like, that has nothing to do with us. That's a third-party finance. But it's just like so much bashing because it's an Aspen. You went to an Aspen and you had this experience, which half the times things are just so dramatized and just they it's their experience of whatever they've made up in their head, and there's nothing that we can do about it. It is Aspen. On the flip side of that, it's like, oh, I moved from Texas, like you said, I moved from Texas, or like Dr. Mark said, I moved from Texas. I want to find another Aspen Dental. Boom, you got an automatic patient just because of your name and you're in the area. So people like to continue treatment. So brand recognition has, its pros and cons. The other thing I will say, I'll be quite honest, that gets on my nerves. Once again, it's a pro and a con. We have a call center. They call the call center. They want to book an appointment at Aspen Dental. They help you out. Call center will book me. And I'm like, wait. I'm tired. Wait a minute. I didn't want that. Hold on. But it's such a blessing. There's so many offices, especially with private practice, who don't have any patients coming through the door. The patients, like at the end of the day, that's how you live, that's how you eat, that's how you pay all of your bills. So it's a huge blessing to have an influx of patients and the advertisement that we have. So that's why I'm like, it's a pro and a con, because it's sometimes like, wait a minute, call center, I don't want you to put somebody there. Wait a minute, don't tell them we take this, because we don't take that. But call center is there to help, and it's just like awesome to have something like that. So
I mean, what I will say is, and I've run into this situation a few times, it's always the patient comes in and says, why do I need periodontal therapy? I've been going to a private practice doctor for X amount of years. It's always been a regular cleaning. What do you mean I have periodontitis? And I think a lot of, for whatever reason, private practices, they don't really go in that depth about perio and things like that. Especially there's some older doctors that just, I guess, didn't believe in it. So you run into this patient saying, I had a cleaning a year ago. What do you mean my teeth are loose? So that education's really beneficial, but it can also be a little bit like we have to explain it today, take the time, explain it to them. And if I'm being honest, Aspen isn't for everybody. If you're the type of person, and there's nothing wrong in it, if you want to go once or twice a day, do maybe a filling or a crown here and there, and that's all you want to do, absolutely, there's nothing wrong in it. But that's not the place for you in Aspen. But if you want to learn everything, do as much as you can, be the best version of clinician of yourself, be able to, do the extractions, the endo, the veneers, the Invisalign, do all of that, then yes, this is the place for you. But if you're the type of person, and again, nothing wrong, if you just want to take 1 or 2 days, do a few crowns here, a filling there, and that's all you want to do, probably Aspen is not the right place for you. At least in my opinion.
100%. I think you guys brought up some great points there. We have a great question here, and the question is almost 2 parts. So is there a production target in terms of revenue production for the office? And are you required to meet that target in order to be compensated? And I think that's a great segue also into quotas. So Dr. Tucker, do you want to kick this one off?
Oh, sure. I get paid every day. I don't have to do, that's the beauty in Aspen, right? I have friends at every DSO. I've talked to or almost every DSO. So I hear the different things. I've interviewed with multiple DSOs. I still get offers from other DSOs. And what I will say is, for your duration of your time here at Aspen, you get paid every day. It doesn't run out after 3 months. It doesn't run out after 6 months. It doesn't run out after a year. You're going to get paid every day you come to work. And that's the type of guarantee I like in my life. I'm a lifestyle girl. If you can't tell by now, I have a lifestyle that I live. So I need a guaranteed something, right? Now, this part depends on you. How hard are you willing to hustle? We have bonuses, we have profit sharing, and it's not based off of what's in your chair. It's based off of how the practice does as a whole. So that's what makes it cool. That I worked my first office, it was 3-4 doctors. It's not just what's in my chair. I don't have to fight for procedures. I don't have to do any of that. I don't have to tussle like, this is a $12,000 bridge. I don't have to do that, because you're going to pay from it, so am I. But we all want to do well so that we can all bonus. You want that extra money at the end of the day, whether it's to put aside to, save for something, or if it's to travel, shop. But either way, Aspen makes sure that your bills are paid. Everything is, you come in to work, you're going to be paid, like regardless. So I hope that helps. But
Yes,
not every company is like that. So I would say while you're doing your search and you're talking to people, what if you have a daily rate, how long? When is that going to run out? Like, you want to know those things. And if it's not guaranteed forever, every day that you come in there, I wouldn't do it. That's just me.
Thank you, Dr. Tucker. Yeah, I think what's really important is, like you said, each DSO, it runs a little bit differently. Something about Aspen is, like she said, we have a guaranteed daily rate that never goes away. On half days, on half day Fridays, you still get your full daily guaranteed. And in addition to that, you get a percentage of the profit of the practice. So at the end of each month, we pool all of the production between all of the doctors, the hygienists, and the traveling specialty doctors. And then you get a percentage of that additional profit share. The exact percentage is tied to your patient satisfaction score for your office. I think that's really important to take into account because we're keeping top of mind what everybody that's coming to the office is coming for every day, and that's to make sure that our patients have the best experience possible. So another question I'd love to segue into, we actually have somebody in the chat who is going to be going on a site visit in just a few days at an Aspen Dental location. So wishing you good vibes for your site visit. They're wondering if there is any specific question or anything that you would encourage them to ask while they are visiting on their site visit. Start with you, Dr. Shergill.
So the main couple of things that you should be asking is, one would be, how is the flow of the office, which is very important. How does the doctor go from room to room? How are the assistants? How are the patients? Because to be honest, the vibe of the office is the most important. And the culture is very important. And that's something that varies from office to office. And part of the reason where I'm at is the moment I walked in, it was like meeting old friends. The culture was very important to me, and knowing that how efficiently, like I said, there's a very fine line between being busy and productive and being overwhelmed. So when you come in, you ask what kind of procedures you're doing, what the vibe of the office is, meet the assistants, meet the office manager, meet the doctors, walk around, see if you can see if you can see yourself being a part of that team. And if you can, and if it feels right, that's generally all that matters, because the clinical, that will get there. The management, the leadership, that will go there. The vibe and how you see yourself, that's the most important thing, at least for me.
I think that's an awesome answer. We have very limited time left, so we're going to try to get through a few more questions here, docs. We'll try to do maybe one answer per question like we've been doing, and then Elizabeth and I just have a few words to wrap it up. This is a similar question here, but is there any words of advice that you have for dental students that are considering Aspen or other DSOs? And I'm going to add to that, is there any advice that you would give them while they're still in dental school? I think it's a great reminder these aren't just D4s on the call. We have some D1s, D2s, D3s. So, Dr. Mark, you want to take that?
Sure. I guess there were a couple questions in there. Advice while you're in dental school is where I'll jump in. Number one, for any D1s or D2s out there, get involved in organizations at your school. I was really involved in ASDA, and that took me really far. And it's still kind of helping me out in a lot of ways in terms of leadership, but also just in terms of knowing dentistry, making connections and whatnot. The other big thing, take time to learn about dental contracts. The Aspen one was super favorable. I spent way too much time. I attended CE on it. I looked things up online, researching how, things to look out for in contracts and whatnot. And I had some offers from some other DSOs that paid a lot, like insane amounts of money, but I just saw all the red flags in it. Take time to actually learn what to look for in contracts. And then in the actual curriculum, one thing I wish I took more advantage of in dental school, I really wish I spent more time shadowing at this in like this different specialty programs. That is one resource that's going to be hard to come across once you're out on your own. Not because specialists don't want you shadowing, but because you're going to be working. You know, you're going to have plenty of time to do all the crowns and bridges and fillings and whatnot in the world while you're practicing. Get into your specialty program, shadow them, see what they're doing, see why they're doing what they're doing. And I think that'll take you pretty far when you go out and you're practicing on your own.
Awesome, Dr. Mark. Thank you. Another question that we've got, is there anything that you would change so far in your Aspen experience when you look back on this last year and a half? Dr. Tucker, is there anything that you change in your time here? She looks like no.
No, I wouldn't. Like, that's my mindset is just kind of, I'm a make the best of it type of person, and I can kind of see it from both ways. I'll be very transparent with you guys. Everybody, a lot of places, hospitals, Aspen was no stranger, DMV, like everybody suffered from a cyber attack, just to be completely transparent. It was a definitely a tough situation, and we had to learn to navigate, but I wouldn't choose any other place to be at during that time. Number one, we like went back to paper charting for a little bit and like tried to like navigate that while having the internet down. So I learned a lot through that, but I also learned that Aspen is the type of company and it has the type of manpower and to be able to get a system back up and running and make it new and improved. They already had a new system in place that we didn't, you know, our lives weren't completely shut down from it. And they took care of their employees during the shutdown, and it just was incredible. So it was such an ugly experience, but to be at a place that takes such good care of you, and we still got paid. Yeah, period. So we still got paid through it. They put a new system up, and that's the type of place I want to be at, not a place that, you know, all hell breaks loose and they just can't recover from it. So that would be all I have to say about that.
That's a great one. I tried to like let that escape my memory.
It's
but
like COVID, but like
it
like the
is.
Aspen version of COVID, I guess.
But like Dr. Mark said, we all got paid. So that guaranteed daily rate comes in clutch. We make things work. We kept the offices open as much as possible, which I think attributes a lot of, it shows a lot about the character of the individuals that are in place at Aspen Dental as a whole. On that topic, I would love to wrap up a last question before we kind of wrap things up with a couple other things, and talk about the culture at Aspen. I think a lot of people really start to see that in the events that they go through to in dental school as D1s through D4s. And there's some pretty neat things that happen, you know, at Aspen when you are a clinician and you are practicing. So I know Dr. Shergill got to experience one of those special things just recently. So Doc, do you want to tell us a little bit about the culture at Aspen, what it's meant to you, and maybe touch on that event?
So yeah, the culture is, like, to me, is one of the most vital things, because that's, you know, you get up, you go to work, and if it's a good culture, it makes you want to be at work. And it's been so supportive from my regional manager to the director to everybody in general. I met Dr. Mark at, like I said, our new doctor journey for the first one, and then after 6 months again. So they really coach you through all these other things. They really support you at every single point. It's not like an office manager dictating production goals or anything like that. You work with them, they're your partner, and they support you at every step of the way. About that event, it was in Florida. It was a leadership retreat. I know Dr. Mark was there as well. And I'm sure Dr. Tucker was there as well. It was a lot of fun. It was 3 days of lots of good food, music, and shenanigans, to put it lightly.
Mm-hmm.
I've heard one of our doctors say it's very much like a family feel here at Aspen. I think even down to your support teams, such as Elizabeth and I, your office managers, your dental assistants. I think everybody would say that. I have an owner that calls it's his country club membership. Which I think was a kind of a great way to put it. So it's kind of neat to see everybody come together. Sometimes it's an annual basis, sometimes it's more of a quarterly basis. So, I want to go ahead and thank the doctors for joining us tonight. I know we have just 2 little points to wrap up on. I know many of you are or have heard about our We Got You program. The We Got You program is a program that we have put in place over the summer for D4s that are in the process of looking for a career with Aspen Dental. It is basically a 36 to 48-hour trip to our headquarters in Chicago, where you are getting a deep dive look into who we are as Aspen Dental and what we do. So you get to sit in on some implant training. You get to talk to the Straumann reps. You get to hear from many of our VPs of clinical support, who are really truly the backbone of mentorship and all things CE at Aspen. So, if that is something that you're interested in, please go ahead and reach out to us. I do have a QR code here. You can scan that QR code. I'll put it up in just a second, and that will put you on our radar. You will receive a call here within the next couple of days. It might be Monday since the weekend is quickly approaching, but we will talk to you and see if that's a fit on something that we can do for you. So a really fun trip. Elizabeth, as I'm doing that, do you want to just talk about the raffle really quick?
Yeah, definitely. So I'll just hit on We Got You with Paige just a little bit. This is such a great program for D4 students who are currently in the process. So if you've got a site visit scheduled, an interview, you're in talks with a recruiter and there's a location that you're interested in, ask them about We Got You. If you're not in the process with an interview, you don't know where to start, Maggie Maurer just dropped her info. You can reach out to her directly and she'll get you in contact with your correct recruiter. It's never too late to get started in the process and to start coming to these fun events that, Dr. Tucker and Dr. Mark had head on with the fun food and drinks, which may just end up getting you to We Got You with an awesome job opportunity with Aspen. So lastly, we're just going to hit on our gift card raffle. So tomorrow by end of day, the winners of the gift card raffle will be selected and notified. In order to be eligible for the gift card giveaways, you had to register for this call and stay on for the duration of this call. So that's why right now we're not announcing the winners. We want to make sure that we can, weed out the people that registered and didn't attend. So all of you great students who took the 1 hour tonight to hear from our Aspen doctors, you guys will be eligible for the gift card giveaway. So stay tuned. By the end of the day tomorrow, if you have been selected, you will be notified. So thank you all so much for joining us. Thank you, Dr. Mark, Dr. Tucker, and Dr. Shergill for joining us all tonight and asking all of the questions on students' minds. Please feel free to reach out to the doctors. Their emails are in the chat as well. Paige, would you like to close it up?
Nope. Thank you so much. We will send out a recap email with contact info as well as that QR code in case you weren't able to scan it in that quick short minute. But we appreciate you all and have a wonderful finals week and a safe and happy holiday season. Bye, guys.
Bye, everyone. Thank you.